Hello everyone, welcome to Physiotherapy in Lesotho, www.physioinlesotho.ch. You are listening to a podcast from one of our physio workshop in Lesotho. Your speaker is Thuso, W. Fasser, a qualified physiotherapist.
We welcome you to this afternoon about bodywork manual techniques. We decided to divide the large group so that we see you in the smaller group, that we can teach you effectively one of you. We will work on the massage of the back. We will improve our physiotherapy skills and we will learn to massage nicely the whole back from the pelvis up to the neck. We have done already the neck, the shoulder girdle and the arm yesterday. So today we will learn the massage, the medical massage of the back, the spine. We will divide in two groups then. First we show you how we will do it. Then we divide in two groups. One group will come with me to the demonstration room and the other group will stay here with me, Teresa. And then on the late afternoon we come together and we will work again on exercises, active exercises, and then we do some questions to close the afternoon. We appreciate that you still come to school even on Sunday afternoon. We decided to do like this, so on Tuesday afternoon you will be free to pack your own things that you can go home on Wednesday nicely. So, massage. If you think where we will apply physiotherapy skills, so we remember physiotherapy skills from nurses will be applied in the hospital, because sometimes maybe on Saturday, Sunday the physiotherapist is not there, or maybe there is a need in the evening, or maybe in the early morning, or maybe the physio patient is asleep during the day, so later in the day he's awake, so you will be able to help him. We apply them as well on OPD or the TB center or ART center, but then a very important level where again you as a nurse assistant will be engaged is on the health center level, because very rarely in a health center there is a physiotherapy assistant or a physiotherapist, so it will be up to you to employ these techniques. Or on the community health level. So community health worker, you can teach to do that, to use it in the home care for disabled patient, elderly patient, or maybe AIDS patient or TB patient, disabled children, etc. Sometimes it's just helpful to know that. So we use it on the hospital level, on the health center level, and on the community health level. In all these levels you are present, and sometimes it will be helpful when you can engage these physiotherapy skills. Now we are centering this afternoon on the massage, the medical massage we call it, or classical massage for the back. Which patient do need this type of treatment? We have many situations where we use that. Let's say maybe in maternity you have a mother who had maybe a very difficult birth. So she will be there for a few days and she has back pain after that a bit difficult, rough birth. So you can help her a lot with that classical massage on the spine. Maybe you have a pregnant woman with sciatica down the leg, a bit of pain coming from the back. You can help her with that massage. Maybe it's an elderly person and she has pain just by old age, musculoskeletal pain. You can help her. Maybe you have a TB patient. He's already cured by TB, but he has this flexed back, this kyphosis, and he has pain on the neck and the spine, the back. You can help it. Maybe you have a patient after trauma and he has some back pain. There is no fracture on the bones, but he has these strains and pains on the muscles. You can help them with that. And maybe you have somebody who had a stroke and now he's body shape is no longer perfect, symmetric, so he's already walking, but he has some tight muscle. Just by not walking correctly, you can help them by ease off a little bit this tension. So there are many indications where we can use this very simple classical massage, and we will go and teach you. What do we have to remember? First, hygiene. If there is no scratches or wounds on the skin, we can work nicely with our eucalyptus oil, and with the bare hand you can massage. If there are scratches or little wounds, insect bites or so on, it's better we use the gloves. If we know this is a HIV positive patient, just as a rule, use the gloves. You could do it without, even if there is no wound on the skin, you could do it, there is no danger to infect yourself, but let's stick by the rule, we use the gloves. So we are always on the safe side. We never know who is HIV positive or not, therefore we always apply these hygienic rules. Where there is no damage on the skin, you can just do it by the bare hand with the oil. Second, where there are infections of the skin, we are not massaging. Where there are severe inflammations of the skin, we are not massaging. Where there are wounds on the skin, we are not massaging. If somebody has thrombosis on the leg, we are not massaging. These are contraindications. If a person is feverish, we are not massaging, because it's too strong for the body. These are contraindications. Let's remember that. Third, let's remember, massage should be comfortable. It shouldn't be painful. Even sometimes people think as much you do, as hard you massage, as better it is. No, when we produce pain during massaging, the muscle gets more tense. It should be comfortable. It should be nice, comfortable, and not painful, so we can relax. Massage can be always in a relaxing way or in a more tonifying way done. If we move slowly and gently, the muscle relaxes. If we move quickly with the hands and rapidly, sharp movement, the muscle will tonify. So if we have somebody who is tight and tense, he has a hypertone muscle. So we move slowly. If somebody maybe is too floppy in the muscle, is not enough activated, maybe after bed rest, everything is a bit low tone, floppy. So we do a more rapid massage, more active massage. If somebody has cold and the circulation is not strong enough, so we do quite a rapid massage to increase the circulation. So we always can decide we massage in a relaxing way or in a stimulating way, activation way. So we have to decide that before we use the massage. Normally we have patients with tight muscles, so we have to relax them. So we work in a very calm, relaxing, slow way with the people, and then they can relax. We place the patient on a bed. It can be the patient's bed, and it can be his own private bed if we work at home. If there is no bed, we can work on the floor as we did yesterday. That's okay. Patient put his blanket there, maybe his t-shirt, and is lying on the t-shirt, and we cover it with another blanket. If we are in the hospital, we just take away all the pillows. One pillow is enough, and we take a bit away the blankets so patient can't move, and on a clean sheet we massage the patient. If we are working in the physiotherapy room, patient is lying on the physiotherapy bed, putting his own blanket on top of the bed, so he's lying on his own blanket. We don't have a sheet for every patient, so let's use the clothes of the patient and the blanket of the patient. So it's for hygienic reason, it's okay, he's in his own clothes, in our own blanket, that's fine. We put that blanket, the patient is putting on it, and then it's fine, and we cover it. If we are in winter time, and it's very cold in the place where we're working, sometimes we don't have a real warm room. okay, we have to work through the clothes. We still can do a good work through the clothes. It's better when we are working really on the skin, but if it is too cold, patient will become shivery and tight because it's cold, so we cannot relax him. So we have to work through the clothes. If we have an elderly person who is a little bit cold, we don't ask them to take off the shirt because they will get even more cold, so we work through the clothes. But in general, if it is enough warm, we work directly on the skin. If it is too cold or the person is cold, we work through the clothes. If we are in a situation where there are other people coming in and out, let's say on a health center, there is no guarantee for the privacy, so sometimes we are not undressing the patient, we are just doing it through the clothes. We can do it. It's not the perfect way, but it's still an acceptable level we can do. If patients are able to lie down, we will do it in lying down. If patients are not able to lie down, or we have not the situation, we can do it while sitting on a chair. And if there is a table and patient can put the arms on a table, it's even better. But normally we ask them to lie down. If it is on the floor or on a table, improvised on a table, or if it is on the bed, that's fine. Can you understand the way I'm talking to you? Okay, that's fine. Now, I will show you now how to do that massage, and then we will split up into the groups.